So let me start with the first medicine, what I call as time as medicine. And interestingly, this is the most powerful medicine, which you all have, but maybe a little bit awareness is required. So we have to understand one interesting thing about the body. For example, nowadays, in television, social media, you have been seeing people are dropping dead. Suddenly, while in the gym, while driving, or while even having a marriage, or even garbha these days, people are suddenly dying. Apparently without any reason, and mostly the youngster. Certain heart attack, certain cardiac arrest, these are the very common thing nowadays, and we are shocked and surprised trying to understand what is happening. There is no doubt, there is a complete clarity that it is because those two vaccines which people took. But now, if people ask me how to know that I am prone to heart attack since I have taken the vaccine, so is there anything through which I can at least see my future? So that is what is time as medicine. The first medicine you must understand. Through this you will understand what is happening inside the body. You do one experiment tomorrow. Tomorrow morning at 10 a.m. you take your blood pressure. Your blood pressure is here. It can be anything, 140 by 90, 160 by 100, whatever. Now, in the night 10 p.m., you take another blood pressure. You will find your night blood pressure is here, and always your morning blood pressure is here. It is never same, like this. It is also not this, like this. If it is this means your chances of heart attack is very, very less in comparison to certain people. If it is like this or this means the night blood pressure is higher than the morning blood pressure. That means these people are known as, medical term, non-dipper kind of people. This means they are more prone to heart attack in comparison to rest of the population. Why I am telling you this? Because I want to tell you there is a timing for everything in the body. This timing is being decided by, in this case, blood pressure. It can be kidney, heart, lung together. They decide what should be the blood pressure right now. Right? It is not same all the time. It is in response to what is happening all around. So that is the timing for blood pressure. You do one experiment again, maybe tonight. This question you are asking, unable to sleep properly. You will realize every night before you sleep, your temperature dip by a fraction, 0.5 degrees Celsius. And that dip in the temperature causes you sleep. There is a timing for pressure, blood pressure. There is timing for temperature. If someday your temperature do not dip, remain same, you will not be able to sleep. Right? So sleeplessness is one of the major problems. And the solution is ensure somehow if you could dip the body temperature. If I want to make you sleep right now, I have to dip the body temperature, your body temperature, by half a degree. And if I can achieve it, probably you will feel sleepy. Especially if I achieve it after the sunset. So normally body does it on its own. That is the circadian clock of your temperature. But for many of us, sometimes the body is unable to dip the temperature. And that means that night, you will not be able to sleep properly. You will not be able to sleep at the very first place. So what is the solution? Solution I told you. You have to ensure that your body temperature should dip. How I can do it if the body is not doing it? One way which we do in our hospital, or I suggest to my patient, enter the bedroom only at the time when you want to sleep, and let the temperature of the bedroom be cooler 1 degree or 2 degree than rest of the house. The moment you enter the bedroom, that environment is cool in comparison to the rest of the room. This means your body will start automatically dipping the temperature because of the environment. And that causes sleep. But somebody say, I don't have air conditioning in my house. Don't worry. Then you take a very, very hot water bath about 40 minutes before the time you want to go to sleep. When you take a hot water bath, what is happening? The temperature of the body will increase. But after that, the body temperature will again come down to normal. This coming down causing a sleep. coming down, causing sleep, right? So this is the timing for everything. But now how this method we can use to control the blood sugar, control the blood pressure, even the non-dipper night blood pressure is higher, more prone to heart attack, how to reverse it, this can be one question. To find the answer, these are the research papers which you can surely go through, but again, if you're lazy, I can help you to solve the problem. The rule is very clear. Time as medicine, the rule is very, very clear. Do not eat anything before 8 a.m. or after 6 p.m. Eat within the bracket of 10 hours. 8 a.m. to 6 p.m. Finish your dinner by 6 p.m. After that, don't eat anything. What I just said in last 1 minute, if you just follow this one rule, you will be surprised, rather shocked to see that your blood sugar will start reducing for those who are diabetes patient. Blood pressure will start dropping within 7 days to 10 days, those who are blood pressure medication, those who are taking. Chronic pain all over the body, that will start reducing by 15 days to 20 days. Even your sleep pattern will improve. Your depth of sleep will improve. Even the problem of dementia, somebody was asking, it will start vanishing. Time as medicine. So this means, in my hospital, when the patient comes, irrespective of the disease, the first thing we do is, we don't give the breakfast before 8 a.m. And we finish the dinner by 6 or 6:30 p.m. So free medicine, right? And since he is in a hospital setup, he is having no other option to eat. And irrespective what is the disease, we know the first rule which we apply for all the patients, they are destined to see some relief in the form of reduction in pain, in the form of better sleep, in the form of more energy, in the form of lot of other things, parameters like blood sugar, blood pressure, etc. All those things. Time as medicine. How we do it exactly? You have to understand, when you start doing it, we have seen the cancer, they start reversing. If you are fat, many people they say, I don't want to change the quantity of food or the kind of food I eat. I am not asking you to change the quantity of food. I am not asking you to change the kind of food. Only I am asking you to change the timing of food. I am not saying that you should eat this or you should not eat that. I am not saying you have to eat only this much. I am just saying eat within the bracket of 10 hours, 8 a.m. to 6 p.m. So once you start doing it, how much time it will take to see the result? Maybe 1 day or 2 days, at the most 3 days. So this medicine is available to everybody. You eat by 6 p.m. as much as you want.